Hello everyone, this is Chadi AlRaeis from SASIS 2024. I'm really privileged to be with an esteemed panel talking about the Saudi CTO Club. Thank you for joining me today. So I'll start with you, Waqar. Excellent presentation today, as well as an illustration of CTO case at the meeting. Let's talk about the case itself in terms of your approach quickly before we jump to more into the CTO realm.
Sure. The case as we presented today was a patient with a CTO, which actually shows what happens in CTO. It appeared to be a lot simpler than when we actually started doing it, and then it became obvious to us it's a lot more complex than what we anticipated, and which is very important in CTO cases, that there is no simple CTO case. Sometimes, yes, they take 15 minutes, but sometimes you end up doing 4 hours, and you have to be prepared for it. So this was a left anterior descending artery, total occlusion, appeared to be a low JCTO score, maybe 0, 1, and we thought we will be able to do it with 1 or 2 wires and we'll be done. And it turned out to be quite a marathon, and thanks to Gabriel, we were able to complete the case.
Awesome. So Gabriel, from your experience, what do you think an average number of CTO an operator should be doing a year to be comfortable with the CTO approach?
Yeah, this is really a good question. We have considered at least 50 CTO PCI per year for having or maintaining the skills for doing CTO PCI, but it's something that it's not so rigid, because you in this field you never stop learning, and probably one of the most added value of CTO community is exactly the interaction, because each of us know that we can learn a lot from each other. So sharing different experience, attending meeting or discussing together, or also creating some common database or registry could be really helpful for growing together. So this is probably, from my point of view, the most important things in this field, sharing experience.
Thank you so much. As a segue and to recap on this point, Khalid, you mentioned offline that there is a plan to put a Saudi registry for CTO. Can you tell us a little bit about it?
So, as Dr. Gasparini mentioned, to create a community of CTO operators, collaboration, because it's an ongoing process of learning. You're done with your fellowship or your training, that's not enough. You have to share cases, success and failure with your colleagues in order to achieve an optimal outcome. And what we tried to do when I came back from Canada in the late 2018, there was no documentation of how many CTOs are done, how it is done, are we doing the right thing, the hybrid approach, are we doing what has been done outside. More, we know the success rate of a hybrid algorithm can reach up to 92, 95 in certain centers. We want to see what's our local data to try to compare and to improve if we want, because what we found that a lot of CTOs in the country was not tackled correctly by non-CTO operator, using a workhorse wire and call it a failure. So this is something maybe to improve the service for these patients and to have data that we can compare ourselves in the region to the well-developed registries elsewhere in Europe and the States.
So I'm hearing from you is number one is awareness of the problem. 2 is finding the cases to kind of center of excellence. So is this an effort happening now, or is like a mission for teaching and education?
The Saudi CTO Club, we do have, this is our mission, to educate ourselves. Like Gabriel said, we learn from each other, so improve ourselves. And at the same time, educate our community which cases are appropriate for referral for CTO PCI. Not every CTO needs to be done. An asymptomatic CTO doesn't need to be done. So this is our mission, to educate ourselves, educate our community, and most importantly, improve ourselves. We have to be always in a self-improvement mode, and we can only do it when we measure our work and go ahead with that.
But what Khalid is saying also, that maybe you have more CTO than what you think, because that you don't know what your denominator is at this point. But once you have it, you think you are ready to have enough proctorship for the program?
Yeah, we will be having enough. We have enough operators who are qualified to do the cases. And like I said, not all cases need to be done. But Khalid is right. A lot of cases are left to medical therapy or referred for surgery without somebody actually attempting it.
So Gabriel, you mentioned something interesting about the two operator approach. Like what we used to use sometimes with TAVR, having two operator, having thinking. Now TAVR becoming more easy, but CTO always get complicated. So having two people, is it just for discussion, learning new technique, or just for a bouncing idea that we saw today illustrated wonderfully in the case?
Yes, yes. Once you decided to build a CTO program in your cath lab or in your hospital, you should take in consideration that it should be not a single man job, but it should be considered as a team job. It means that you should involve a colleague as a second operator, or you can also switch as a first and second operator. It doesn't matter. It's also necessary to involve all the nurse staff, because they should take care of the ACT value, for example, or for blood pressure, because the operator are focused on the procedure, and they are just looking at the tip of the guide wire. So this CTO program should involve all the staff and also the administration of the hospital as well. And having a second operator could really help you in maybe having a different opinion or a different idea, that so the second operator can suggest you, why don't you consider to go retro or to use a different guide wires, and then this helps you in order to achieve success. That is our aim, of course. Success in terms of procedural success, it means benefit for the patient.
Well, at the end, I would like to thank the panel, Dr. Khalid, Dr. Gabriel, and Waqar for your time. I'm coming to you from SASIS 2024. This is Chadi AlRaeis, and with me was the Saudi CTO Club. Thanks for joining us, and see you next year. Thank you so much.
Shukran, Shadi.